Pathologist assistant and a clinical pathologist. The daily tasks for a pathologist assistant are to keep files up to date. They can train other residents in the pathology program, and they can do research and assist the pathologist. Clinical pathologists' daily tasks are to examine and diagnose diseases. They analyze tests and tests that might be ordered by the patient. They also consult with physicians about results and other tests that may need to be ordered. A pathology assistant work environment is usually in a lab, and they can be exposed to many chemicals and many different ranges of temperatures. They're required to walk and stand for long amounts of times and can lift up to 25 pounds. A clinical pathologist work environment, they can work in labs, hospitals, and clinics. They can also do research at other universities. They can also lift up to 25 pounds and be exposed to chemicals and range of temperatures. They work full-time hours and sometimes even night shift. A pathologist assistant education. To be a path assistant, you are required to have a minimum of a bachelor's degree or a certificate in the 2-year pathology assistant program. They have to have a minimum of a 1-year training experience, and if you have a degree above a bachelor's degree or the 2-year pathology assistant program, then that counts as work experience. The clinical pathologist can either have a bachelor's degree or in chemistry or pre-med. They also must go through a residency period, pass the MCAT, and be issued a state pathology license. Pathology assistant salaries are roughly $89,000 a year, and clinical pathologist salaries are roughly $120,000 a year. Pathology assistant's regional outlook is suspected to grow 28% and be in high demand within the next 10 years. A clinical pathologist's regional outlook is only suspected to grow 3% within the next 10 years. My thoughts and comparisons on a clinical pathologist and a pathologist assistant is that the pathologist just does lower work. The pathologist assistant just does lower work than the pathologist. They get paid less and are required to have less education, so they can't do as big of jobs as the pathologist. They complete all the work that the pathologist needs to be done to be able to complete their job.